The next muscle in our series of muscles that you may have forgotten about since school or even never learned about in the first place is going to be Quadratus femoris. There's lots of quadratus muscles we talk about. Obviously, Quadratus lumborum, QL, is super known and everybody knows that one. Not everybody knows about Quadratus femoris, but it can be a really useful muscle to release on certain people. Showing this from a draping perspective is a little difficult, so you're going to have to visualize a little bit of what I'm talking about. But basically, attached to the greater trochanter, and there's a thing specifically called the quadrate tuberosity that's basically on the lower part of the greater trochanter. And then that comes over to the lateral edge of the ischial tuberosity. It can be very complex to think about all these different locations if you visualize the upper leg as being a straight line. However, what the upper leg actually does, the femur does, is go diagonally this way and then cuts in that way into the acetabulum. And so the greater trochanter is this giant space back here, and the ischial tuberosity comes down in a loop under here. And so you can really think of Quadratus femoris as living up into this space over here. So if I'm here and I'm trying to laterally rotate the lower leg, that is basically what the Quadratus femoris will do. And so I can come up here, and if I have you hold this, Brianna, so I can palpate the hamstrings all the way up to the upper attachment and let go. That's going to help me find the ischial tuberosity. And then if I come a little bit lateral from there, you can even see, I don't know if you can see that on camera or not, but I'm pressing on that there, and you can see the lower rotation down there. Right, as soon as I press my thumb into this lateral rotator, the whole lower leg is rotating out. And so once I've got my thumb in there, I can do a little bit of internal and external rotation right on that and get into Quadratus femoris. It's going to be a little muscle, maybe about that big, if that. Sorry, maybe about that big, maybe even not that big. And it's going to run roughly from there to there. And so again, if I come up under here, find the ischial tuberosity, come a little lateral and press, I've now got external rotation of the lower leg. That's definitely telling me I'm on it. Scale of 1 to 10, Brianna. How not so awful or awful is that?
Like a 6, 7.
Cool.